Good evening, friends. I'll be talking on this topic, give a brief overview on how to read the forest plot. So, this question was asked in DRNB exam and even in the FAT exam. And for all the IC trainees, it is imperative and important to know the basic nuance of understanding how to read a forest plot, especially in all the meta-analysis, which forms an important body of evidence. So, wish to acknowledge my colleague, Dr. Pradeep Surli, who helped me develop this content. So, why is it important that we need to understand forest plot? Because you would know that forest plot is the statistical uh, sort of a tool that we use in meta-analysis and systematic review. So, when you look at the literature review, so basically we crystallize the core essence from going through the vast literature, doing a systematic review, and then we do a synthesis of data and analyze, which leads to meta-analysis and make some sort of a conclusion. So, why is it important? Because in the hierarchy of all the literature, so meta-analysis and the systematic review have more sort of a strength with regards to the evidence, and we give more weightage to it. So, if you look at the sort of the lineup, it is a pyramid sort of an approach. So the least amount of strength is for these case reports and opinions and the letter to editor and so on and so forth. And following this, it will be these animal trials and cross-sectional studies, case control, cohort. And even if you see randomized control trials, they come little below. And meta-analysis and systematic review forms the core of the strength of evidence. The simple reason is because it takes a collective sort of a inputs from all the randomized control trials, or it is conglomeration of randomized control trials or other cohort studies, and then you synthesize the data and then generate sort of a conclusion out of it. So that is the reason that it gets little more weightage. So this is the sort of a hierarchical lineup of the strength of various types of studies that one conducts. So that's why it is important to know as to how we read meta-analysis and how we understand the graphs that come out of meta-analysis. So when you look at how this systematic review or meta-analysis is conducted, basically you first have a question in mind. What is the clinical question that we have in mind for which we are looking for answers? And then we sort of create a protocol of the design of the study to try to extract the data to create an answer for the question that we have in a mind. And when we define the protocol, we obviously search for all the literature. So this is just a pictorial representation of how we scout and search for all the studies that have looked at this question to look at the answers that they have derived for the question that you have framed. And then we select the amongst, because there will be a ocean of studies, so we would quickly sift through the studies and select the ones which are pertinent, which has addressed the questions that may lead to the answer that we are looking for. And then we would extract the data from that particular studies that you have identified and try to put this data together and synthesis and do the synthesis of the data. And whilst we extract the data from the selected studies, it is imperative and important to look at the quality of the studies that we have taken. So, because even when we do meta-analysis, it has to be taking all oranges together or apples together rather than putting everything into one basket, because we cannot, very often you would see in meta-analysis, they would have taken randomized control trials, they would have taken even cohort studies, but then they would again segregate them and they would put RCTs in one sort of a group, and then they would put cohort studies in one group, and then they would do meta-regression analysis to sort of generate the answer, so on and so forth. So basically, you have to determine the quality of the studies that has been picked up from where the data has been extracted to synthesize the data. So then the next step would be the synthesis of the data and and interpreting the data that comes from putting all these studies together. And then we would then discuss after the data generation and the synthesis of the data. So we would look at what has emerged from the data, then have discussion and conclusion. Then we would do systematic review, doing certain statistical tools would be applied to do a systematic review, and then dissemination of the data. So the last one is the dissemination of the data. So this is the sort of a framework along which the meta-analysis or systematic review is done. So first I have a question in mind, create a protocol, look for the studies and try to extract the data from the suitable studies, determine the quality of the studies, synthesis of the data, discussion, systematic review and discrimination. So in exam, just at least you put this figure uh, to understand the flow of how systematic review is done. So then the question is, why make a forest plot in the first place? So that's the question that comes in the mind. So as I said already, that there is a ocean of literature, and you have one question that you are looking at, and there may be ocean of literature which is looking at that particular question. But the problem is, when you look at the ocean of literature, there are some studies which may come out, and there are studies which come out with different conclusions for the same question. You have one question whether crystalloids are useful. For that, if you look into the ocean of literature, you may have varied conclusions that come, and they would have used varied statistical modalities. So that is where there is no sort of a homogeneity with regards to the answer that you are looking for the questions that you have posed. So there are different conclusions that come out of different studies, and they would have adopted different statistics. And at the end of it, you may leave confused because some studies may be for use of certain things and some studies may say against. So the simple example is if you take saline also. So there are some studies you will get X number of studies which will favor saline, and there will be Y number of studies which will favor against the saline. So that is why we have to put these studies together and generate some answer which gives a comprehensive uh, sort of an answer as to what is the right thing to do. That's why meta-analysis is important. So what meta-analysis does is for the same question, so it will take all the studies and try to apply common statistics and put it in one axis to determine the answer for that question. So basically, it is the collective data interpretation that happens and the collective results that you will get so that some answer in some collective format comes out of it. So that is the gist of the whole meta-analysis. For the same question, you take all the studies where different statistical methodologies are used and you put some common statistics to make sense of all the data of the collective data and get some sort of a common result and some sort of a common answer at the end of it. So that is the gist of why meta-analysis has more strength, and that is the reason why we resort to doing meta-analysis. So now coming to the crux of how to read the forest plot, because that is the question that has been asked, and that is what we are here to understand. So when you look at the forest plot, I'm sure you would have seen all the listeners here. Most of you would have seen. So there is an x-axis and there is a y-axis on this. So and every aspect of this forest plot has a meaning. So this y-axis, what you see, the line which is at the center is called the line of null effect, and the horizontal axis is where all the statistical tools are done. So it can, so where the data is represented as odds ratio, or data is maybe represented as a hazard ratio, or it may be represented as a relative risk, or there can be representation of absolute risk reduction, or there can be standardized mean difference. So these are some of the statistical tools that are expressed on the x-axis, and the y-axis is the line of null effect. So basically, line of null effect, which I will talk about in little detail, is basically telling you whether there is association or no association between the exposure and the outcome, or whether there is no difference between two interventions. So that is what it will tell you, and I'll talk a little bit on detail on that. So the line of null effect is 1 for odds ratio or relative risk, and it is 0 for absolute risk reduction or standardized mean difference. So just going into the details of how the forest plot looks. So this is the framework of this. So y-axis and x-axis. Then you have these lines that come in. So you need to understand what this line is and what each of these represents. So when you look at this particular line, you would see in any forest plot, these lines are there. These are data representation. So the square one you see in all these lines is the point estimate of the study, and it determines the size of the study, the number of patients. So the larger the square, it tells you that the bigger is the study. So if you see here, this particular study has a bigger sample size, or the study size is bigger as compared to this particular small little box where the size of the study is much smaller. So that is what it indicates. And what is that line indicate? So that line is the confidence interval, which I'll talk. And this y-axis, we said it's a line of null effect. And the result of the study is represented as a combination of that square and the line. And the line represents confidence interval. So this line, as you see, represents the confidence interval, which we call as 95% confidence interval. So it is very important for every listener to understand what does this 95% confidence interval mean. So 95% confidence interval, we do ask in Viva, in especially IFCCM exam or DRNB, what is confidence interval? And many a times I see students struggling to answer. It is where 95% you are 95% of the times you are certain that the data lies within that sort of an interval. So that's what 95% confidence interval is. And I'll talk a little bit on that. So, and then you have this x-axis, which will basically tell you on which side the data is favoring. Either it is favoring the control or it is favoring the intervention or the treatment group. So that's what it would tell. So, so the 95% confidence interval is where you are 95% of the times you're certain that the true value lies within that sort of a range that you have determined. So you are 95% certain that the true value lies within this sort of a boundary. The end of this line is called the boundary. So within that boundary, the true value lies. And one thing that is important is in your when you are interpreting the forest plot, if you are 95% confidence interval, if this line is crossing the line of null effect, so it means that your null value is possibly reflecting the true value and it is not statistically significant. So because this is the line of null effect, so line of null effect, as I said, is 1 for odds ratio or relative rest, and it is 0 for a standardized mean difference and absolute risk reduction. And if this line is crossing this line of null effect, it means that your null value is possibly representing the true value and is lying within that boundary. It means it is not statistically significant. So that is the importance of understanding the 95% confidence interval. So again, pictorially in exam, the easiest way to represent your confidence interval is either you show this and say you're 95% certain that the true value lies within this boundary. And if it is crossing that y-axis, it means in all likelihood the null value is within that range and it possibly represents true value and it is not statistically significant. And in exams, if they ask, it's best to put this figure, and most important in confidence interval is the narrower the confidence interval, greater is the precision of the study. Because you would have heard me telling often that although it is statistically significant, you would see that the confidence interval is very wide. So when it is very wide, it means the precision of the data may be questionable. So the narrower the confidence interval, better is the precision of the study. And the simplest way to explain that is, so you put this figure and these are the outliers, and 95% of the chance or 95% the true value lies within that boundary is what determines confidence interval. And the diamond. So in forest plot, we spoke about y-axis, which is the line of null effect, x-axis. So in exam, if they ask, I would expect every trainee to write a diagram. You cannot write all this in sentences or in words. The simplest way is I would expect at least 5 diagrams. One diagram showing what your y-axis is the line of null effect. The x-axis is the statistical data that is represented, and that square box is the point estimate and the sample studies. The examiner will clearly know that you have a conceptual understanding, and that line is the confidence interval. And confidence interval, so here if you see the confidence interval crossing the line of null effect, it is not statistically significant. If it has crossed the line of null effect, then it is statistically significant and it is representing that it is either favoring or not favoring the intervention. And diamond. Diamond is a very simple, it is a collective sort of an estimate of all the studies. So it is a point estimate and it does represent confidence interval. It is just a combination and average of all the studies put together. And if you see this diamond, so the hypothesis for the diamond also holds true that if it crosses the line of null effect, it is not statistically significant. And if it is beyond this line of null effect, then it is statistically significant. That's what it means. So that's why forest plot is important to understand the nuance of how you look at the graph, you know what is statistically significant, what is not statistically significant. So, and then you would see in the forest plot, like I've thought of breaking up all the forest plots to see the components. And you would see in forest plot where you would have a list of studies. So these are all the list of studies that tell you in which year they were published and the reference of the author. And then you would have the, as I said, the point estimate. The square represents the point estimate and the size of the study. And that is also indicated in the numbers here, where it will tell you how many are in the control arm, how many are in the treatment arm, and what is the total number of patients. So that's what this represents. And this represents your individual studies, relative race, odds ratio, hazard ratio, individually are represented here, as you would see. And if you see here very clearly, see every line that has crossed the line of null effect, they are not statistically significant. As you see, all these are not, but diamond, if you see, it is beyond that line. So that's why this confidence interval is statistically significant. So it's very simple. So I've seen very often trainees struggling to understand when the confidence interval is significant, when is it not significant. The simplest way is to look at the forest plot that will clearly tell you when it is significant, when it is not significant. And this is an important thing which I think all trainees should know. In meta-analysis or systematic review, we look at the heterogeneity of the papers because we have taken papers of different sort of a quality and put together. So we need to understand the heterogeneity. If there is too heterogeneous, then the value of the conclusions that come out of the study also becomes questionable. So there should be a measure. There should be a measure as to how we measure heterogeneity. For that, there is a statistical tool that very often it will be mentioned in the lower part of the forest plot. So as you see here, it is I have just expanded that in the lower plot. There's something called I squared. You see this I squared, which is 38%. That is the statistical tool. Let us not go into the detailing of how I squared is attained. So I squared is the number that you look to look at the heterogeneity, and I squared for all our trainees should be less than 50% to say it is acceptable heterogeneity. If it is more than 50%, then it will dilute the quality of your whole meta-analysis. It means too heterogeneous and the conclusions you have made possibly does not hold good promise is what it means. So here I squared is 38, which is acceptable. Less than 50% is what is needed. So heterogeneity of the papers basically reflect upon the researcher bias and the data collection problems, and it will determine whether the results of the study has come out as a chance or is it a problem with all the data and the bias that has happened. So I squared, as I said, should be less than 50% to for the acceptable heterogeneity. If it is more than 50%, it says it's a bad thing, and that is something that one should keep in back of mind to look at the heterogeneity of the study. So we spoke about how meta-analysis is done. We spoke about different components. We spoke about y-axis, x-axis, the point estimate, the confidence interval. Then we spoke about heterogeneity determined by I squared. So in exam, you have to mention all these so that there is a good conceptual understanding on how you interpret this data. Then the last thing in meta-analysis is the funnel plot. So this is also very important. So funnel plot looks something like this. As you see, these lines which form the triangle are the 95% confidence interval, and each dot is an individual study. And you see they're all scattered. Basically, they are also telling on the precision of the study. So all the studies which are of a greater precision, this is very important. Please listen this out. So all the studies with the greater precision, which have a better precision, are present on the top of this triangle. And the studies with the lesser precision are present at the bottom of the pyramid. Very simple. Low precision are present in the lower part of the triangle, and the greater precision are present on the higher. It's a visual representation of the precision of the studies that are done, and the precision of estimated intervention is larger in size. It's basically greater in size. So if the precision is better, the size of this also will be bigger. So as I said, the studies with greater precisions are present at the top, and the studies with lesser precision are present at the bottom. So it's a visual representation of the precision of the sort of a studies, and the size also is much bigger with the greater precision of the study. And the x-axis even here is typical of the forest plot. It represents odds ratio, relative risk, or absolute risk reduction, or standardized mean difference. So this is So this is the funnel plot. So very easy, the visual representation of the precision of the study. So that is what you need to keep in mind. And what are the possible reasons for asymmetry? As I said, even in the forest plot, so we saw the researcher bias and uh, problems with the data collection, and then you had a heterogeneity sort of a score. Even here, there are various reasons for the asymmetry of the plot. Again, they are similar. It's researcher bias, data collection problems, or poor methodological quality. So if there is a poor methodological quality or the size of the study is small, as I said, see, even in the funnel plot, it says the greater the size, precision is better. So if the if the number of patients, if the size of the study is small, then the outcome also is exaggerated. So that's why we need a large study for greater precision. So if you have a smaller size, then the results will be more pronounced. That's what methodological. If the methodological quality is poor, the effect also will be appear very exaggerated, and it will represent true heterogeneity is also is something that you can make out from this panel plot, and that can be artificial. So if you are applying odds ratio or standardized mean difference, they are inherently prone for certain errors, standardized errors, so which you will read more about when you dwell into the depth of statistics. And there is something called chance effect that may reflect the quality of the studies. And this chance effect leads to more false positives in these studies. So these are some of the inherent reasons why there is asymmetry in the funnel plot. So to summarize, so in forest plot, if a question is asked, if you cover this much, this is more than enough, and this is what you need to understand meta-analysis or when you read meta-analysis, because so we touched about how meta-analysis is done, we touched about various components of forest plot, then we touched about heterogeneity and what is the number we should have in mind to determine the acceptable heterogeneity. Then we spoke about funnel plot, which basically determines the precision of the studies. So the greater precision studies are found in the top of this pyramid and the lower precision are present. If you write this much with all the figures, that should be more than enough. So hope this video will be useful for all of you to answer this question. So I invite all my esteemed listeners to attend to the signature meet, which is happening from 17th to 20th October. 17th and 18th are the workshop days, and 18th to 20th are the conference days, which is happening in Bengaluru. So request all our team listeners to submit your valuable work to Journal of Acute Care. So you can visit my website to rehear to this lecture. So thank you one and all.